Knock, knock. I wash my hands. Morning, Vivian. How are you?
Good morning.
My name is Camille Guilaret. I'm the Tutic Physiotherapy. How are you?
Nice to meet you.
Nice to meet you. Do you mind if I have a seat here? Alright, as I told you, Vivian, I'm the physiotherapy. I just want to make sure I'm with the right patient today. Would you mind telling me your full name, date of birth, and age, please?
I'm Vivian, and I was born and I'm here in the
Alright, cool. Thanks for sharing that with me. I got from your notes that you got a laminectomy done 4 weeks ago. Is that correct?
surgery.
Yeah, sure. So, as you can see here, Vivian, this is an exam situation
So
for me.
laminectomy, that was, they took a little bit of the bone off,
Part of the
right?
bone off.
Yeah. Is that what it is, isn't it?
Shit, yeah, for sure, Vivian. So I was telling you that this is an exam situation for me. You will see my assessors here, X and Y. Is that right for them to be here? Okay, good. Have you been in physio before? Probably yes.
But didn't do much for me.
Alright, but you know what physio looks like. So let me just do a quick refresh of how my session is gonna look like. It's gonna take roughly 50 minutes. The first part is going to be me asking you questions to get to know you better. Second part will be hands-on assessment, planning some goals together. And the third part will be doing some exercises. How does it sound to you?
Good.
Sounds good? Correct.
Well, hopefully you do better than the other physio.
Oh, alright, let's try to make that happen.
The surgery, I tried everything. The surgery was,
Was the last resource. So,
fixed it.
In that terms, Vivian, would you mind telling me what led to the surgery? What happened? Why did you have the surgery done?
I had lower back pain for a long time, right? And 20 years ago, I injured my lower back. Yeah. And since then, it's always stayed with me, right? I tried everything. It's
So
a long-term history.
20 years.
20 years. And that's why I had to retire as well. Yeah, I was on compensation. I got that through.
All right.
And because of my back pain. And then they, 20 years ago, injury, workers' compensation.
What job did you
Factory, slaughterhouse.
All right.
Factory.
A lot of
caring.
Caring things. All right. So Vivian, because you injured your back 20 years ago, so what happened that you got the surgery done after 20 years, or what changed, or what were your symptoms? That's what I'm trying to know.
It was, low, in my lower back, and then it was radiating down on my...
Alright, so you were feeling pain alongside your leg?
Yes.
What part of your leg was painful? Was the back, was the front?
No, it was more on the... here, along on the buttock.
Alright, buttock.
And then, it was traveling
down
here.
Alright.
Like
I can see that you are bending pretty well now. Did the surgeon told you to avoid the range of movements? Did he told you about that?
Yeah, he did.
Alright, so during the session, Vivian, I will try to make sure you don't bend forward too much, because that's one of the indications and the precautions from the surgeon. Alright? So,
okay, thank you.
Let's put things together. So you were having pain. Apart from pain, were you feeling something else, like pins, needle?
Yeah, pins and needles.
A
whole lot, so pain, pins and needles.
Pain.
Numbness.
What else were you feeling there? Like, was this like a shooting pain? Was burning pain? Was stabbing pain?
No,
shooting pain. It was really hard. And
what nerve pain?
What number would you say it is, or what score would you give?
7 out of 10.
If you hear me, I will be able to let you know how can we rate that pain. All right. So if it goes from 0 to 10, where 0 is not pain at all and 10 is the worst imaginable pain, what number would you say it was?
I was asked this before. That's why 7. 8 out of 10.
Was there something that was aggravating your pain?
Yeah.
What sort of things?
So just normal daily, walking.
Walking was something that aggravated your pain?
Really
something
bad.
else?
it's still, you know, still not normal. Yeah, and then bending forward,
Alright.
you know, so we're, yeah, and then just twisting, you
Twisting.
know, so doing the things,
What
you
sort
know,
of
like
things
on
alleviated your
you know,
pain?
nothing,
Nothing.
you know, nothing
Was there
really,
the
you
whole
know,
day
so
with a
just,
7?
so,
Was all day there with a 7?
yeah, more or less, yes, yes.
Alright. And the first thing in the morning, as soon as you woke up, the 7 was there?
Yes.
Alright. And did you had any painkillers, any medications done?
Yeah, they gave me something, but they
Didn't work.
didn't do much. And then the physio, you know, they sent me off to physio, didn't do much.
Alright. Alright. So, and then you got the surgery done. What happened then? How did you lay? Did you lay?
Instant relief.
Instant relief.
Instant relief, you know, so.
What about the pain now?
Right now, so 0 was nothing, they said, yeah, 4.
You
4
would
to
say
5.
A 4 to 5 constant pain. Is it constant pain?
No, not constant anymore.
Alright.
Fingers crossed, yeah.
Alright. So
Yeah.
your baseline, when you're not moving, when you're laying down or in a comfortable position, how is your level of pain? There.
Nothing.
So would you
know,
say it's a
yeah,
0?
it's a 0. Yeah.
So now, what sort of things aggravate your pain
Walking.
now?
It's still the walking.
Walking hurts
Still
a
the
lot.
walking, yes, the walking is the, you know, what's really.
And the pain still runs to your foot, or it?
No, that's all good now. So yeah.
So
Yeah.
where is the pain now? Localized?
Just in the buttocks.
Just in the bottom.
Yes,
Well,
yes.
That's something good, because it means that the pain is centralizing, meaning that the pain is not more in the foot, on the leg, and it's coming back towards the spine.
Yeah.
Alright, that's a good sign. Alright, Vivian? But yeah, still having pain for walking. I know that this is it's better than before. I mean, it's not a 7, it's now a 5, but still a 5 is still high. So we are going to keep that. 4 to 5.
Yeah.
Still painful to walk. Alright?
Yeah.
What about the pins and needles? You still experiencing them?
That's all good.
They are gone.
That's all
Numbness,
No, that's all good.
sensation impairments, like any
No,
problems
not
with the
that I
sensations?
noticed. Not that I noticed for now, you know.
So, pain 0 out of 10 when you are not doing much, and walking 5,
Yeah,
between
4
4
to
and
5.
5 out of 10. After would you say 1 minute walking, 2 minute walking, 100-meter walking?
50 meters.
All
Yeah,
right.
before, you know, right now it starts at 50 meters.
Alright, and
meters,
just before surgery, how long were you able to walk?
500.
500 meters?
500 meters.
But with a lot of pain.
With a lot of pain.
Alright, so I know that you are
After
using.
50 meters now,
Mhm.
you know, it starts.
Alright, I know you are using your two forearm crutches. Are you using them the whole time?
Yeah, they gave me 2, you know, when I got discharged from hospital. So, but you know, now that I'm feeling much better, I'm not sure whether I should tell you this, but you know, at home
It's
I
good
just
to-
only had one.
It's
You
good
know?
you tell me that information, Vivian. As long as you are being honest with me, I will be able to help you in the better way. So if you are using the forearm crutches the whole time, it's better for you to tell me.
No.
And if you are getting rid of one or the 2 of them, it's also good for me, because on that way I will be able to properly assess your safety. You know?
I have one.
Do you have one? So you
I
already got.
use one.
You just use one? Alright, the whole time? What about inside the house?
Yeah, one.
One, and what about outside the house?
When I know that I have to go
Far?
far, I have 2, but usually one.
Alright, so most part of the day you tend to use only one. And which one are you using now? The right one, the left one?
Yeah, I couldn't really remember. So my right leg is sore, right? And then because I couldn't really remember, I have it on my right leg, on my right side.
Alright, so you are using just the right one. And
Yeah,
just
just the right
some
one.
cases, in some occasions, you use both of them. It's good for me, because I know what to expect. And if I pick up something that is telling me it is not safe for you to get rid, of the crutches, it's better for me to know because I can address that properly.
Good.
You know what I mean, Vivian? Great. So, good. I think you're doing pretty well. Have you been doing any physio in this 4 weeks after surgery?
Yeah, after the surgery, yeah. So she did, just boring stuff with me, like kind of.
Have you been doing that at home?
Yeah, more or less,
More or
but
less
but that doesn't really do anything for me, So
I mean,
she just,
you're doing pretty well now.
Yeah.
So that's because
I think it was the surgery.
Yeah, for sure. I mean, the surgery did the biggest part, but now physio will help you to make that improvements last longer.
We have to wait and see.
Yeah, for
So
sure.
hopefully you can convince me about that.
Oh, for sure, Vivian. That's my, my.
I've been through a lot of physio.
You have been through a lot of physio. Yeah, 20 years with
only
lower
surgery.
pain. Surgery probably was the best thing that you had because you got your instant relief, and that's really good. Now we need to have physio exercises and strengthening and work on your balance to make those changes, to make those improvements to last longer.
Okay.
Make sense to you?
Okay.
So I'm gonna make sure to assess you properly and then treat you properly according to the guidelines, so we can be sure that we are going to do the proper exercises to make you safer and get rid of that pain finally.
Yeah.
All right. So good. I just want to get a few information of your overall health. Do you have any medical condition? Do you take any medications on regular basis?
Yeah, just the painkiller if it's getting too bad,
Right.
So, but it's not.
Was that a schedule that your GP or your surgeon gave to you?
Yeah, but I wanted some good stuff, some Oxycontin or they don't give you these anymore, do they?
All right.
They only gave me the.
I don't know. You can tell me what are you having now? What are you having now?
Yeah, just the normal stuff, Panadol.
All right. That's
over the counter. Osteo.
Over the counter medications.
Yeah.
All right. And do you think they are working well on you?
Oh no.
That don't
so if they do, they do a little bit, but I think, if they could give me some Targin or something like that.
All right. So you feel like you need stronger pain relief?
I do feel so.
All right. So what about Vivian? At the end of the session, I write a letter to your GP and the surgeon as well, to let them know that you feel like you need stronger pain reliefs in order
that
to.
would be good.
All right.
So
yeah, they can come back with any.
Make it an ongoing prescription.
For sure. So yeah, Vivian. Do you, if you don't mind me asking, do you smoke?
Yes, I do.
All right. And do you still smoking after surgery?
Love it.
You love smoking, for sure. And what about Vivian? Have you ever anybody talk to you about the benefits of quitting smoking?
Yes.
For sure, I'm pretty sure. And have you ever think about giving
I
up?
tried, but it's a hard one to beat, So I know what to do, but right now with all the pain and everything.
Yeah, my mom used to smoke, and for her it was really, really hard to. But I want to make sure, Vivian, that you are aware that there is a lot of resources available, information, support, and groups where you can find that extra help that you need.
Thanks, Physio. Thank you. I know. Thank you for the reminder. So.
All right, but I want to. I highly recommend you to engage on those groups and those sort of information. I know it's hard, but I want to make sure you are aware that.
I stopped smoking for a little while, and then.
All right.
Anyway.
Let's move on. All right. So just make sure. I just want to make sure you have the resources, and if you can give it a crack at the end of the session, that would be great. All right. What about alcohol?
Today? Oh God.
Yeah, for sure. I mean, what I mean by that is that at the end of the session, you can think about receiving that information, those booklets, and engage you on that sort of information. Just be open to get the information.
Okay.
Alcohol intake.
Oh yeah, you know, I have socially I drink, you know. So, but I like after, you know, I like to drink a beer,
Mm-hmm.
you know.
How often would you say it is?
Not much. Maybe, you know, 2 times a week.
Two
Something
times a
like
week.
that.
And how much do you drink on those occasions?
Just two, you know, 2 pints. You know, 2 pint sizes. You know, you can get the bottles. You know.
Well, it's not a small amount.
For me. Oh, yeah.
Yeah,
But
I
you
mean,
know, it's not every day. You know.
I know it's not every day. 2 times a week still being a number, and on those days you take 2 pints.
So you want to take this away from me now too?
For sure. If it was
This
my
is
call.
what I don't like of physios.
For
You
sure,
know, they
because you know-
always come up with these things.
For
you know?
sure, for sure. I'm probably. I understand that you're exhausted, but as you can imagine, physios are always promoting good health, and you know overall good
Okay.
good health. You know what I mean? So
Yeah.
probably that's a
All
speech that you
right.
haven't heard before. I'm pretty
Yeah,
sure.
Okay.
Yeah. I don't want to bother you. I just want to make sure I covered I tick all the boxes for you.
Yeah. Okay.
All right.
Okay. I do understand that now,
Yeah.
but you know, it really gets up my nose. You know, like
All right.
Jesus, what's left in you know?
Let's move on. No
Yeah.
worries. We can talk about in future sessions.
Mm.
All right. What about your household? Do you live in a single-story house?
No, it's
double-story
double
house?
story, eh?
It's a double story.
Double story. Yes, we were
Do you-
lucky, you know, to get that.
And what about the steps and ladders to the
Oh,
second
the
floor?
16 steps.
Are you navigating
16.
them now, or are you staying in the
No.
first floor?
Downstairs.
Room and bathroom are in the first floor. Your room?
Bedroom is upstairs, but we have a bathroom downstairs.
So you have to go to the second floor.
No, I sleep downstairs.
So you
I
have your
sleep
bedroom in the
downstairs.
first floor
Yeah,
now.
yeah, I sleep
All right.
downstairs. Yeah.
So everything is set on the first floor.
So far, yes.
Are you?
So I sleep, you know, yeah, it's not ideal because we don't have that much room there.
Mm-hmm.
But it's not like the bedroom with an ensuite, but we have a spare room, you know.
Downstairs.
So yeah.
All right.
I
And
sleep
what
downstairs.
about the entry of your house? Is it a flat thing
No,
or
just one step.
one step and rails? Do you have rails there?
Yeah, you know, the OT came once.
All right.
You know, so
And he assessed the rails inside your house and outside
Yes,
your house.
that's been done. Yes,
All right.
yes.
All right. And you are having any troubles showering or getting dressed or going to the toilet so far?
Yeah, you know, so it was, you know, it's all the bending and everything.
Now, are you
know,
still
and
having
then
those
bending back.
problems?
No, it's okay.
All
You
right.
know, I've got, you know, somebody who can assist
All
me
right.
there.
So,
yeah.
what are your hobbies, Vivian?
I like knitting, you know, knitting, crocheting,
Something
and
else?
walking was a big, you know, I really do like walking.
All right.
You know, I really like to go back to walking and, you know.
And
That
you told
was
me
my-
that now you are retired, so you're not working anymore.
Yeah.
That's all right. And yeah, so Vivian, what are your expectations from today's session? What do you want to achieve today?
That you can convince me that physio can do a good thing.
All right.
Yeah,
That's
that's
the
my
first thing,
expectation,
convince
and
you.
not come up with, you know, some sort of, you know, kind of,
Boring
you know,
exercises.
yeah,
Alright.
yeah. And that's what, yeah, and
Alright.
yeah, maybe, you know, so to make me walk better.
All right. Did the
I
surgeon?
don't know whether we can do this today, but.
All right. Did the surgeon give you the precautions after surgery? I just want to make sure
Yeah,
you are aware of
yeah.
them.
Yeah,
What
not to bend
things-
too much.
What things to do or what things to avoid in order to keep you safe?
Twisting.
Are you
know.
aware of them?
Yeah, I've got this booklet or this pamphlet.
All right.
you
So,
know, so.
would you consider like one of the goals to make sure that you are doing everything necessary in order to keep you safe?
Yeah.
Yeah?
Maybe,
And-
yeah.
Being, receiving some medication in terms of what things to avoid doing?
Medication?
No. Information.
Information, yeah.
Yeah?
Yeah, I think, yeah.
For
that
sure.
might be something.
Anything that you would like to add for like a short-term goal for today's session?
Yeah, walking maybe, you know, like short-term, yeah. You
What,
know,
what
that is
walking?
what bothering me the most. Yeah. For
So,
today, yeah. I mean, to show me maybe an exercise which is not boring and which doesn't
alright,
cause, you
got
know, the pain.
for sure.
Yeah.
So I just gonna make sure we are covering all the boxes and ticking all the
Yeah,
boxes.
yeah.
I will actually ask you a few questions, just to catch anything, any thing that will require further assessment. So have you ever experienced any headaches or loss of vision?
No.
No. Any unremitting pain in any side of your body apart from that one on your leg? Any
Always
chest
been
pain?
fit.
Chest pain,
Chest pain, no.
cough, night sweats,
Yeah, from
chills?
the smoking a little bit, you know.
Sure. But not, is it an ongoing cough?
No.
Alright,
Only when
sometimes.
I had too many.
Alright, and did your GP aware of it?
About the coughing?
Yeah.
Yeah.
Cool. And what about swallowing problems or problems articulating your words?
No.
Any sudden weakness in any side of your body?
No.
Any sudden loss of sensation or sensation impairment?
Sudden? No.
Sudden, alright. Any problem with your bowel or bladder? Any issues with that? No. Cool. Yeah, I think we're done. Probably if something comes up, I will let you know and I will ask to you. Alright, Vivian? So we're going to do our hands-on assessment. Alright? I know you don't have problems with your vision and hearing, but I just want to make sure you can see me clearly.
Okay.
Yeah? Can you see me clearly?
Yep.
Alright, can you hear me properly?
Yep.
Beautiful. Problem with your upper limbs? Not at all. Pain, pins, needles. Cool. You feel
Sometimes, but it don't cause me.
Alright, cool. So let's focus now on your lower limbs. Alright?
Yeah.
Now, this was your injured side, so I'm not going to ask you to bend your knee over. Alright? The first thing that I want to make sure is that the further you can go is a 90-degree angle between your trunk, your body, and the leg.
And why is that?
Because I don't want you to overstretch the surgery site.
Okay.
Makes
So
sense?
the nerves come out on the side
Yeah.
there, and then we don't want to put stretch on there.
Alright? That's the first thing. So,
Okay.
can you raise your left knee up towards the ceiling for me? And keep it there. Don't let me push you down. Good job. Extend your knee. Don't let me push you down. Alright, go down. Go down now. And don't let me pull you. Don't let me pull you. Good job. Knee, toes up. Good job. Now relax your leg. Any problems there? No? Okay. As I told you, I'm not going to assess your range of motion here. I want you on the plane, alright? But kick out the leg for me. Kick it out, alright. Hold it there, don't let me push you down. Alright. Toes up for me. Don't let me push you down. And press my hand. Good job. Now, don't let me pull you. Don't let me pull you. Alright. Any problems, pins, needles, pain?
When I stretch a little bit this, you know, look down and
You feel, what do you feel there?
yeah, then it's, you know, like nerve pain or something like, yeah.
What number would you say the pain is?
Maybe 6, you know.
Alright, it's really bad. And as soon as you release that stretch, it goes away.
Yes,
Beautiful. So, yeah, close your eyes for me, please, and let me know if your your big foot is up or down.
Up, down, up, down,
Cool. Down to the right.
up, down, up, down.
All right. Close your eyes. Keep your eyes closed, and let me know if does it feel the same.
Yeah.
Feel the same. Feel the same.
Yeah.
All right. Feel the same.
Yeah.
Feel the same.
Yeah.
Feel the same.
Yeah.
And does it feel the same?
Yes, it does actually.
Does it feel the same?
Yes.
Feels the same?
Yeah.
Alright, cool. Open your eyes. Good job. Now, I know you are using your 2 forearm crutches, so show me please, how do you stand up from there?
So, yeah, I always have them next to me,
Sure.
right? And then I
How do you
Just
stand up? Good.
push up, and then I
Alright.
grab the crutches.
Grab the crutches.
Yeah.
Alright, keep it there. Now, put weight on that right leg. Does it hurt?
Yeah, it's just, it's still a bit tender from all that.
Yeah.
So it's only been.
Alright. Now, rise your knee up toward the ceiling, your right knee. Keep it there. Good job. Now change to the other side.
Just stand on there. Okay.
Yeah. Standing on one leg. You feel it's weak? It's giving way?
Yeah, just a little bit, yeah.
Alright. Now 2 steps to the left side.
With my crutches.
Yeah. Alright, and now to the left. Sorry, for your right. Good. Now, I want to know how your balance is, so I'm going to take out your crutches. How do you feel there without crutches?
Okay.
Feel okay?
Yeah.
Put your feet apart from me, please. Look forward, and I'm going to time how long can you stay there. Alright, 30 seconds. Put your feet together, please, and keep it there. Good job. I'm not going to test you for 30 seconds because you are already doing pretty well. Now, left leg goes forward. Yeah, stay there. Stay there. Alright, get back. Now the right leg goes in front. Alright, no problems, get back. And now the left leg goes straight away in front of the right one. Good job. Change legs. Change your legs. Now the right one goes in front of the left. Alright, this is something that I'm going to test. Wait a minute. 1, 2, 3, 4, 5, 6, 7, 8, 9. Alright. Let's say 10 seconds and you had to, you lost your balance. Just with the right in front of the left. Alright?
Yeah.
That's something that I'm gonna write down and compare in the future sessions.
Okay.
Alright? Now take back your crutches and walk with me, please. We're going to go to the chair that is there and gonna do a 3-meter walk. Sorry, time up and go. Go.
Go.
Go. Go to the chair. Alright, have a seat here. And we are gonna do now a time up and go. Alright? So what does it mean?
With my crutches?
With your crutches. You're going to walk with your crutches, both of them. That's the prescription, 2 crutches. I know. But now we are going to make an outcome measure to see how do you do and if it's safe for you to get rid of one. Okay? Alright? So that's, in that way, we will assess it properly if it's safe for you. Okay?
Makes sense.
Makes sense to you? So what I want you to do is when I say go, you stand up with your crutches, walk to the 3-meter mark here, turn around, get back, and have a seat. And I'm going to stop the timer. I want you to walk fast in a safe pace. Alright?
Fast?
Fast in a safe pace.
Okay.
Alright? The fastest you can go in a safe pace.
Okay.
Alright? Are you ready?
Mm-hmm.
1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Good. 12 seconds. It's pretty good actually. If it goes like under 13.5 seconds, it means that you are not at high risk of falling. So we can safely
That's the last thing I need.
we can safely say, because also your balance was pretty well, I'm pretty confident that getting rid of one of the crutches will be something good for you. All right, so it's something that we can try for sure. All right, so I still want you to use your 2 crutches and go to the parallel bar. Come with me. Right, use your both crutches and let's go to the parallel bar that is here. All right, so you are now into the parallel bars. Get me here, and what I want you to do is start breaking down the walking pattern. All right, what does it mean? I want to train you on a few stages of your gait that are missing. Okay, so the your right leg, you will see that is not landing on the heel, and then you are missing a little bit of the toe off this part of the gait. All right, and the second thing that I want you to train is that every time that you are walking, you do your right step, and then the left stops there, and I want your left leg to step through.
Okay.
Make sense? Not step 2, but step through.
Okay.
All right, the leg has to go through.
Okay.
Make sense to you? So we're just gonna do 2 steps. All right, 2 steps. Yeah. So start with the right.
Okay.
1, 1 and 2 and 3. Sorry, it's gonna be 3. Yeah, and then get back. Go back. Walk backwards. 1, 2, and 3. All right. How is your pain now?
Yeah, it's okay. 4 to 5.
4 to 5.
Yeah, but I still don't like to stand on that leg.
For sure.
So, but let's try. We can try again. Maybe I'm just a bit, in my head.
Is it in your head?
Yeah, no,
for sure.
yeah.
So, first thing first, Vivian, the first thing that I want you to let you know is that the pain is coming back, is getting back.
Yeah,
So, pain is gonna be there for a while,
and you said you want to get me some good stuff too.
well, I'm gonna write to your GP and your surgeon, and then they are going to come back to you with any sort of painkillers or any other solution in terms of the medication. All right, but physical activity will certainly help you, because the movement and get you moving, get you walking, get you active will also help you to reduce the level of pain.
Okay.
All right, because what we want to do is start slowly and gently stretching those soft tissue that was stiff at the beginning, muscles, ligaments and stuff like that, and especially the nerve. All right?
Yeah, I do understand.
All right. So pain is gonna be there for a while, but we already see that the pain is getting back, centralizing, getting back to the spine. All right? All right. Let's go again. And because now we are going to use just one crutch, I want you to stand, so only use your left arm on the parallel bar. All right? Not the right one. Because we are going to simulate that you're using just one crutch.
Okay.
So 3 steps, starting with the right, 3 steps, front.
Okay.
1, 2, 3, and get back. Walk backwards. 1, 2, 3. Good. How are you feeling?
It feels better actually. I always had the crutch on my right side because I couldn't really remember.
That's why you don't have to get rid of the crutches without the physio or the surgeon to tell you. All right?
So where do I hold the crutch?
Always on the left side.
On the other side.
Yeah. All right. So Vivian, let's do 3 more steps to the front.
So I hold on to the bar here.
And then the right, left, left. Walk backwards now. Right, left, left.
Okay.
Make sense to you? One more time. Right, left, right, left, backwards. How are you feeling? How is the pain?
Yeah,
Same
it's
thing?
okay. It's not getting worse.
Alright, that's fine for me. So let's get back to the chair now. Now, whenever you are having a seat on your chair, I want you to first feel the chair behind your knees. Then with your arms, you're gonna reach the armchair and have a seat. Okay?
Yeah.
Make sense?
Yeah.
Probably it's gonna be easier and with less pain for you.
Yeah.
Alright? Now, when we are standing up, I want you to rock a little bit forward for me. Yeah, scoop forward and then count to 3. 1, 2, 3, and you are going to stand up. But I saw you putting your left leg a little bit forward. Probably that makes you easier, but I need you to start strengthening this leg.
Yeah.
Alright? So, up for me. Alright, it has to be at the same level. I don't want to, just make you stand with this one. Both legs.
Okay.
Same.
Both legs, okay.
Alright? Same weight on both legs.
Yeah.
Alright? So 1, 2, 3, up, and now down as I told you. Remember, have a seat.
Sit back.
Sit back, but remember what I told you. Because that way you are not gonna bend forward. You're not allowed to bend forward so far. So what I want you to do is try to get the armchair and have a seat.
Okay.
Like so.
Maybe I need to practice this again.
Yep. 1. Try to make, way better. Alright?
Okay.
So now what we're gonna do now is that I want you to do 10 sit to stands. Alright? 10 times. Yeah, it's not easy. You told me that the exercises before were boring, so now we're going to make it way better again. Alright? Alright, let's go. Up. 1. Down. 2. 3. Let me know how the pain is. 4. Not worse.
Okay.
5. 10. Good. Sit back. How are you feeling?
I can feel, yeah.
For sure. For sure.
That will just do the trick.
For sure.
Better than this,
Alright. Show me how are you gonna walk now with just one crutch. Please. Get the crutch and let's walk to the plinth.
Okay. So. You watching?
Yeah. Go ahead. Go to the plinth. Alright. Have a seat. If you want to lay down, that's fine.
Lay down.
Lay down, facing up. Alright. Now I will be able to assess your the strength of your hip flexors on that knee. Alright.
Okay.
So bend your knee up towards the ceiling. And that's the further you can go, 90 degrees here.
Okay.
Trunk and leg not go over.
Okay.
Alright, this is the further you can go.
Okay.
So far. Then when the surgeon removes the precautions, you will be able to bend as much as you can.
Okay.
Alright?
Okay.
So keep the leg there and push my hand. Push my hand up.
Oh.
Well, it's not too bad. Leave it there. And now push my hand. Good job. No. Leave your feet there. And now pull your buttocks up for me, please. Up. Not too bad. Get down. Now, keep your leg straight and rise it up towards. How is the pain there? Are you feeling pain?
It's okay.
It's okay.
At 4 to 5. Yes.
Alright.
Yeah.
One more time for me, please. Did you feel the pain there?
It starts,
Alright.
So it's,
Are you feeling now the pain?
yeah.
Alright, so relax. The pain is still there. Can you feel the pain running down through your leg?
And just in the buttock and here.
Alright, so leave it there, relax. Close sorry, I'm gonna just do a quick, is it
Yeah,
worse
that makes
now?
it worse.
Alright, what about now?
No, that's better.
Believe, what about there?
Yeah, it starts.
Alright, so what I want you to do is bend your knee, sorry, your head forward for me. Bend your knee, sorry, your head, and get it back, 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 back. Forward for me, back, forward, back, forward, back. How is the pain here?
It's not too bad when you move, yeah.
Yeah, because
Yeah.
what we are doing now is trying to stretch or move your nerve, you know, the nerve that runs on the back of your leg and towards your spine, sciatic nerve. We are trying to do some nerve glides in order to release that nerve from the seat. Alright, so it's gonna run smoothly the more we do this exercise.
Okay.
Alright, so I want to teach you one exercise that I want you to do at home. Alright, so keep your leg there, keep it there. Don't, yeah.
Okay, yeah.
Now go with dorsiflexion, so soles up, and your head has to tilt backwards. Alright, and then tilt your head forward and do this movement 10 times. Alright, you should feel tension here, but not the pain doesn't has to go over a 5.
Okay.
10 times.
Jeez. I have to hold that leg the whole
For
time?
sure. Yeah, you have to. So this is going to also improve your strength.
How was it again?
Yeah.
Like this, wasn't it?
Yeah.
Am I doing it right?
You are doing it pretty good.
Okay.
Alright. Get down off the plane for me, please. Let's get down off the plane. Let's come back to the... Good job. Take your forearm, your crutch on the left side, and stand up for me. Good. Let's get to the chair, back again. Show me how you are walking. Do not sit down yet. So, what I want to do with you is that every time that you are giving one step with the right, I want you to go with the left crutch together. Rub, 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 rub.
So
alright?
it's always opposite, isn't it?
So walk forward for me, please.
Like this?
Yeah. On left side. Okay.
Okay.
Get back to the chair, please. Good. How are you feeling now?
Okay.
Do you feel that the session was better than the previous one?
I think so.
Alright, so have a seat, please. So, two exercises three exercises actually that I want you to do at home. Alright?
Okay.
The first one is going to be the sit up and down 10 times.
Okay.
Sit up and sit down.
Yeah.
Alright?
Okay.
The second exercise that I want you to do is holding the leg up to some nerve glides, as I told you.
Yeah.
Alright? That's the second one. And the third exercise that I want you, or not exercise, every time that you are walking in your household, or if you go out, remember this. Left leg go, right leg goes with the left crutch, and then step through.
So I've done it wrong because I always thought,
I know.
You know, it's been a while.
No worries. So that's why you come to Physio, and Physio will give you good advice, alright?
Okay.
We're going to repeat the time up and go, but now with just one crutch, and see how far can you do it. How fast can you do it, alright?
Okay.
Are you ready?
Just bring everything together.
So, bring everything together, go to the 3-meter walk, or mark, get back and have a seat.
Yeah.
Alright? You ready? Not yet. Remember, I have to say go. Are you ready?
Okay. Yes, I'm ready.
Alright. 1, 2, 3, go. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Bit
So
smaller.
second, that's fine. Doesn't matter if it's lower than previously.
I was thinking too much, maybe.
Probably yes,
Yeah.
which is not too bad. I mean, I'm happy with your gait pattern. It's way better. You're just
Yeah.
just one crutch. You seems to be really really good. And yeah, overall, I'm very happy with this session. I want you to do your exercises at least 2 times a day.
Okay.
Okay.
So sit to stand, and then in the bed, you know, when I'm back, then up.
Yeah.
Okay.
And I want you to keep you walking at least 10 minutes a day.
Oh,
All right.
I have to thank you.
But if the pain goes over a 5, step back and walk just 5 minutes.
Okay.
All right, that's the first thing. The second thing, that I don't want you to twist to the sides.
Yeah.
Remember, bending forward just till 90 degrees.
90 degrees.
That's the second thing. Every time that you are sitting, have a roll back on your back, a roll on your back.
Yeah, yeah.
And yeah, not sitting over 30 minutes, or yeah, no more than 30 minutes.
Okay.
Okay, if you have to sit over 30 minutes, stand up, have a walk, stretch a little bit, and then sit
Okay.
back again.
Okay. Can you write this all down for me?
Everything is going to be written down on your email, same with the exercises. And the last but not least thing is that I don't want you lifting over 10 kilograms.
Oh, okay.
All right?
Yeah. When do I see you again?
Today is Thursday. I want to see you again on Monday.
Monday. Okay.
Yeah, for sure. Any questions for me?
Thank you.
See
Okay.
you, Vivian.